Hello, this is Charles Runels, the inventor of the PRP PShot. I want to explain how this thing came about. So first of all, it's hard to believe, but back in the 1970s and even the 1980s, physicians still told men that the most common reason for having erectile dysfunction was it's in your head. So let me just show you a paper that demonstrates that. This is from Urology, 1980, November of 1980. This is a very respected journal, and look at what they have here. However, most instances of acquired impotency are psychogenic. Any non-judgmental, competent practitioner can aid victims of psychogenic impotence by a listening and encouragement method. Urologists in particular are commonly confronted with genital sexual problems and may be best suited as primary therapists by developing interest in urologic counseling. So here it is, 1980, and the most common cause were thought to be psychogenic, and urologists were encouraged to become counselors. So what changed? Well, obviously we developed some new drugs that cause dilatation of blood flow, because we came to realize that erectile dysfunction had a lot to do with blood coming into the penis. Imagine that. Well, that involves hormones, it involves psychology, of course, but also involves just blood flow. So when we got those drugs, that became a common way to treat it. Viagra, Cialis, injecting vasodilators with a needle with a mixture commonly called trimix. But then this article came out in the Journal of Urology 2003, where the guy says, despite recent advances in therapy, reversal of vasogenic erectile dysfunction is rarely possible. So we have ways to make, as the blood vessel becomes smaller, to help whip a tired horse into getting a little extra oomph by dilating a blood vessel that has become clogged. So this guy says, let's review the vasculogenic erectile dysfunction and see how we can actually help develop a cure, as in not dilate an artery that's smaller, but actually bring new blood flow into the area. So this is 2003, and if you look here, he says neovascularization using vascular growth factors has recently been demonstrated to be feasible in animal models. So then in 2010, I was introduced to the idea of platelet-rich plasma. Now, what the heck is platelet-rich plasma? So platelet-rich plasma has been around for quite a while in reference to wound healing. Here's 437 articles talking about wound healing with platelet-rich plasma as a way to heal tissue that has poor blood supply or has been damaged extensively. But look at how much research has been done. If you just look at platelet-rich plasma in general, you get thousands of papers. There's 7,453 papers. If you start adding it all up, it's about 15,000 papers. You can see all these different ways it's been looked at it. The hip, tendons, cartilage, alopecia, rotator cuffs, dermatology, all these different ways of looking at platelet-rich plasma. So right before I was introduced to platelet-rich plasma in early 2010, this article came out where the investigators published in the Journal of Sexual Medicine, where they took rats that had been bred to be obese and diabetic, like many Americans past the age of 40, developed type 2 diabetes and erectile dysfunction. Then they took stem cells, ADSC means adipocyte-derived stem cells, and they took these stem cells and they tagged them so they could keep track of them, and then injected them into the penises of these rats, 22 rats. Then they looked to see what happened by chopping it off and looking at it in the microscope. And what they found was that 3 weeks after injection, only a small number of the labeled adipocyte-derived stem cells were detectable within the corporal tissue. In other words, the stem cells died. But there was still a significant increase in neuronal nitric oxide synthetase, which of course correlates with erectile function, meaning the erections would have been better if it were still attached to the penis, and in the dorsal nerve, and there were more endothelial cells in the corpus cavernosum of the rats. So there was more tissue and there was better function in this penis, but the stem cells died. So, how do you explain it? Well, we postulate that the paracrine function, that is the growth factors, not the transdifferentiation or the maturation of the stem cells, was responsible for the improvement in penile function. So when I saw this and was told about platelet-rich plasma in early 2010, I injected my own penis. The best I can tell, it was the first time a person had done this, and saw some improvements in the size and the behavior, erectile function of my penis. So I started injecting other people and teaching other doctors. Now let's talk about what that means. First of all, is this somehow experimenting people with some new drug? I want you to see here how platelet-rich plasma is defined by the FDA. To date, the FDA has not attempted to regulate activated platelet-rich plasma. So we should be mindful that it could be regulated, but at this point it's not, because it's a blood product, not a drug. It's a blood product, not a drug. So using that guideline, it's not creating a new medicine, it's using a well-proven blood therapy to rejuvenate the penis. We had great results, and there's been more research coming out since that time. Here's one that came out in 2008, the effect of platelet-rich plasma on the regeneration of cavernous nerves, where they demonstrated crushing the tissue. They're trying to model what happens with prostate surgery, damage to the nerve. Could they see improvement? And you can see the conclusion. PRP can promote the regeneration of injured nervous tissue and the recovery of erectile function. Here's a study showing the application of PRP to the site of crush injury facilitates nerve regeneration and recovery of erectile function. Our research indicates that clinical application of PRP has potential repairing effect on the nerve. So to talk more about exactly what causes erectile dysfunction, because it's not all in the head in most people, it's all in the penis. That is, the head that's attached to the neck is where the least amount of erectile dysfunction takes place. But to explain some of what happens, I'd like for you to listen to Dr. Ronald Varag, whom I recently spoke with about some of his research along these lines. You can see this is us at a recent meeting in Venice, Italy, where we both spoke about platelet-rich plasma and its use. So here we go. Let's just let Dr. Varag talk with you about some of the causes of erectile dysfunction.
Aging erection aging in erection has different aspects. Here you have a real human penis, and you have the two corporeals, and the corporeals are done with smooth muscle and are rounded by albuginea, which is a collagen, very thick structure. What we are going to see is how this is getting old, or how is possible to arrange that. So everything is going old with age, and that might start very early. What we are going to concentrate is in the blue, in the albuginea, in the intracavernous collagen, in the smooth muscle, and in the endothelium. all these structures are present in the penis. The another difficult thing with the penis, of course, is the interacting of all these factors with vein, with neurotransmitters coming from the brain. Also, what is very difficult to handle with is with the interference in between all these factors. And for PRP treatment or any rejuvenating treatment, the reason is that the penis is a mobile organ, as you might know, and it goes flaccid or erect. And this is not very easy in starting a treatment as we want to do. So here I have figured the modification in the aging man with erectile dysfunction, or what is going to give him erectile dysfunction. And we have three components, very important. The alteration of the collagen in the albuginea, which sicken this albuginea, it might come in difficulties for erection, but also in deformation. And that is the so-called Peyronies disease. If we want more, we can discuss later. Second is what happened to the intracavernous structures. And the smooth muscle cells, SMC, decline very quickly with aging. And you see in a study done by a Belgian confrère, Dr. Westpace, you see what happened after 40s, 30s, 60s, and over the 60s. There is only 35% of the smooth muscles remaining. And after this, we have a diminishing of the collagen, which is interesting, it's new, is what happened to the endothelium. And inside the penis, as you can see here, the green structure is endothelium, and the pink one is smooth muscle. They are the two main factors which are going to be involved in erection. And with aging, the endothelium is going to be less, and the smooth muscle will be less contractile, they cannot vasodilate to leave the blood coming into the penis, and they will be damaged and diseased.
So in 2010, although I invented the vampire facelift, which you'll see here.
As more on vampire facelifts. Dr. Runels saw beyond that and coined a designer procedure known as the vampire facelift. One of the world-leading plastic surgeons, Dr. Diamonds, is seeing a major boost in interest as soon as the photo of Kim tweeted out.
This week we have a lot of good procedures lined up, yes. The no plasma is very safe. It's your own blood being injected back in, basically. So it's 100% safe.
So, although I was inventing this procedure to help with the face, what most people did not know is that I was working with the face as a way to observe how platelet-rich plasma worked in more detail so that it could be modified to use for sexual function. So here's what I've found by using platelet-rich plasma in the face. There had never been a serious allergic reaction or necrosis. There have been a very rare instances of a mild allergic rash, but nothing serious as the way of allergic reaction, and no serious side effects ever using platelet-rich plasma in over 12,000 research articles. Also, bruising is minimal because you're using a material that helps control bruising. There's no lumpiness, no nodules ever, and the effects last at least 12 to 18 months and could be permanent because you're actually growing new tissue. There's not something to wear off, it's new tissue. You're not frozen in time, but it's really new tissue, and it's new blood vessels, and it's new nerve tissue, so all parts of the tissue. So seeing that in the wound care, watching it happen in the face, for instance, people who had surgery and trauma with numbness of the face and the sensation returning, scar tissue going away, which would make it apply to Peyronie's disease. New blood flow, the face glowing, which should make erections better. So having seen all that firsthand in the face, I was ready to try it in the penis and injected my own penis in early 2010, then started injecting others and teaching other physicians how to do the procedure. So let's talk about some of the other possibilities, and let's hear Dr. Virag discuss some of those other possibilities for regenerating tissue in the penis, as well as some of his research for platelet-rich plasma in the penis. Here we go.
To date, what are the possibilities of this kind? We have gene therapy, and it's about 15 years now that some of my colleagues tried to do this gene therapy without a single positive results to date. Another study made in California by my good friend Tom Liu is to use stem cell therapy with the adipose tissue. And this is still in study with animals, and there are very few studies of that. And what also has been proposed to do intracavernous injection of stem cells from the neural crest. And this is also experimental and done in rats. So what we have designed to try to is to do biostimulation locally. We call by the name of the young Portuguese researcher who works with me, and we try to increase the natural regeneration of the EPCs inside the penis. So using the PRP technique and intracavernous injection.
So let's talk a little bit about the thinking here. Why did I do this in 2010? Why not go get the stem cells? Why did that project with rats where the adipocyte-derived stem cells die, yet the penis still improved? Why did that work? Well, because the penis already has stem cells in it. There are these stem cells called pluripotent stem cells that are able to regenerate the tissue, waiting there dormant. That's why platelet-rich plasma in the knee, in the bones of the sternum, in dental procedures, why it works is it's fertilizer for stem cells that are waiting there to grow when the tissue is injured. So here's research showing how it was used. This came out in 2013 is when this lecture was done, showing platelet-rich plasma. This was 3 years after I started doing it in my own penis in practice, but showing how it works. So here we go. Very brilliant study.
It's a long time we have tried to do that, and we had a first set of results which I presented already, but it was very difficult to prove scientifically something. So I came with two new protocols, and they are both under investigation. First protocol is in vasculogenic erectile dysfunction, which is not enough blood coming into the tissue because there are vascular risk factors. And the second one is to try the effect of the old age on the albuginea, and especially of the very frequent disease, which is not very well known, which is Peyronie's disease. So we have two protocols. Vasculogenic ED, we have direct injection of PRP, and since Alain told me that you don't use anything else but PRP, we have stopped to use PGO1 inside this protocol. And we have 4 sessions without 2 months, so each 15 days.
So in this study, they used platelet-rich plasma alone, although his slide says with the vasodilator, he was using platelet-rich plasma alone, 4 sessions every 2 months. And later in his lecture, he talks about using 8 cc's total, 4 on each side of the penis. 4 sessions, so once every 2 weeks or so. And no one's sure exactly what the right protocol is. With the PShot, we're going every 8 weeks because we feel like most of the benefit from a procedure really is still happening in the first 8 weeks, and more frequent may be more than what's necessary, although there would be no harm from that, and no one really knows what the right interval is yet. So let's go ahead and listen to the rest of this brilliant lecture.
For Peyronie's disease, it's different. We use echography injections. Under echography, we use injection of PRP under echography inside the albuginea in 3 to 4 sessions. And let me show you just the protocol, as you know. For the first protocol, we inject the PRP in 5 to 6 under local anesthesia, which is very easy to do. We inject and it doesn't hurt at all. The patient doesn't feel anything. We just inject in 5 to 6 place into the penis.
So in this procedure, they use one of the 20-something kits that are FDA approved in the United States. This makes a very good PRP. There are other kits out there. Then he used 6 different injection points. We found we can do it with 4, but who knows what the right amount is. I think part of the number of injection points varies with the size of the penis. You're just trying to spread the plasma throughout the corpus cavernosum. That's the idea here. And he's right, it doesn't hurt that much, although it can hurt some, but it does not hurt that much with a topical numbing cream.
Corpora, the PRP. In the second protocol, we inject under echography inside the plaque, and this is done once to each month during 3 months. This is one case of this kind of regenerative penial biostimulation. You see that there was no blue, no red in this penis, which has very low amount of good cells in the endothelium. And you see about the sessions, the improvement of the what we call the HYPNOT, the penile anal release test, and the orange line is the normal, the lower age of the normal species. So you see.
So what you're seeing here is he has a very brilliant test where they measure erectile function with a constrictor band, and they're able to measure the vasodilatation. And with 4 treatments, the person goes from erectile dysfunction to able to achieve an erection. And they use an erection scale questionnaire as well, and visualization. The bottom line is it worked.
After 2 sessions, we have a good improvement. This subject was 45 years old, and we have also a clinical way to measure the erection, which normal is 25 in 5 questions. At the beginning of the treatment, he had 5 to 7, and we had a previous operation for him to try to improve his erection, but he had very bad results or partial results, and we did 4 sessions of PRP, and he could have good results with erection after 4 sessions. In addition, he was given a supplement with arginine and a low dose of PDE5 inhibitors. And he had efficacious sexual possibilities after 3 months.
So let's go back and look at that. Here's the questionnaire he's talking about. There's a 5-point questionnaire. So here's the questionnaire he's talking about. How often are you able to get an erection during sexual activity? Almost never or almost always. So 1 to 5. Other questions. When you had an erection with sexual stimulation, how often were your erections hard enough to penetrate your partner? almost never, or almost always. Medium would be about half the time. So you can see the lowest score you could get would be, on these 5 questions, would be 1, so per question for a total of 5, and the most you could get would be 5 per question for a total of 25. So in this patient he's talking about, he had a total of 7, so everything was on the low end. He had failed medicine, failed an operation, and they gave him platelet-rich plasma, and he went up to better erectile function, able to have sex. So he's about to show now these results with Peyronie's disease with some pretty significant angulation where they injected into the plaque. We found that even without ultrasound, if you just put enough platelet-rich plasma in here, you get a really nice results. It doesn't have to be absolutely injected right into that if you're just injecting it throughout the penis. But you can see this before picture, and then here's an after picture. Very nice results with Peyronie's disease. And this was out using a pump, which we recommend you use in combination with the platelet-rich plasma. This was just the platelet-rich plasma alone, 3 to 4 sessions. This is very additive, and although some men get a great results with 1 injection, it's worth trying 2 to 3 injections to see an additive result. If you've seen nothing happen after 2 injections, it's probably not going to work. It does not work for everybody. No therapy really does. So we do see the penis become larger, especially when you're using it in combination with a pump. It helps it become straighter, better circulation. It makes other therapies work. You may still want to use Viagra or Cialis along with it. You get better sensation. We've treated multiple people now with loss of sensation with good results. Proven to work. It increases size. There are other studies out now. Platelet-rich plasma is becoming very commonly used. No allergic reactions except for a couple of rare instances of a mild rash. No lumpiness, no minimal pain. So if you want to see if the PShot, Priapus meaning the Greek god of fertility, this is a fresco in Italy of the Greek god of fertility. Priapus with a small letter is a synonym for penis, so this is a G-rated way of saying penis shot. And if you want to see if the PShot or PShot is good for you, then I recommend that you go click on Find Provider on PrioPShot.com, click Find Provider, and then it will put in your zip code automatically. You can put in your country or you can put in your state, and it will take you to where you need to go. It'll list the providers from nearest to you to farthest away. I do not recommend that you see someone who's advertising PShot without being on this website. If they are doing that, that means they're using this trademark illegally, and they may be a wonderful physician, but they may not be a wonderful physician. This is protected by U.S. patent and trademark law, so anyone using this name who is on this website, I cannot guarantee results, but I can guarantee you everybody on this website knows how to do this, and they are using very good platelet-rich plasma. They've agreed to use an FDA-approved kit with excellent standards of preparation of blood in such a way that it's fit to go back into the body and indeed has the required growth factors. If someone is not listed on this website, I can't promise you that they know what they're doing, and they, by definition, are ignoring U.S. patent and trademark law. So this is a protected mark to help you identify people who know what they're doing. So please beware of those not listed here. There's also this tab for reviews where I hope you'll go and post your results, good, bad, or indifferent, so that we can compare notes and see what's going on. Physicians can go here and apply for training to become a provider. Thank you very much. I hope you found this recording useful.